Now, the World Health Organization estimates that 57 million people currently live with dementia globally. 60% of sufferers live in low and middle income countries, but this is expected to rise to 71% by the year 2050. As the world marks World Brain Day, South Africans are being called upon to prioritize brain health from the earliest stages of life. Dr. Stanley Wolberg of the Neurological Association of South Africa joins us for more. A very good evening to you. Thank you so much for your time. As we reflect World Brain Day, one realizes that what you do in your 30s, 40s and 50s has a direct impact on risks later on in life. What are some of the most powerful messages that should come with the significance of World Brain Day?
Well, when we're talking specifically about dementia, which is what you spoke about, what can one do in one's life to protect against it? And it's clear that what you do when you're younger has a major impact later. So we can start with very simple things like, what do you eat? Do you exercise regularly? Are you treating any underlying medical problems? And also avoiding things like head trauma, which can have a major impact. And that can be in like childhood sports at school, and so on.
Mm-hmm. We're learning that the numbers would have, by the year 2050, risen to 71%, with sub-Saharan Africa expected to bear a growing share of that burden. Why is that? I mean, you touched on one aspect, which is diet and food, but why are we heading in this direction?
Well, I think that's a major factor, diet and food. We've experienced in sub-Saharan Africa an explosion of obesity and all that goes with it, things like hypertension, diabetes, and so on. And this is due to the changes in what people eat and the way they live. And it seems to have affected the third world much more than the first world. And that's why we are going to see this major increase.
And what can be done? I mean, what needs to change as one looks at the risks and what could result in so many of these cases coming to the forefront?
Okay, so obviously we'll start with what we eat. People need to be educated about what is healthy eating. It doesn't have to be complicated, but certainly the choices of food and the amount of food consumed, we need to start with that kind of education at a very young age. Children at school need to learn how to eat properly. Physical activity is another important variable. People are not exercising enough. Instead of walking to places, now people are driving all the time or taking transport. People are not engaging in as much physical activity as would be desired.
Yeah.
So these are already two major areas. And the knock-on from obesity, for example, is that it's majorly linked to things like hypertension and diabetes, which themselves are major health risks.
What about the correlation between dementia and HIV?
Okay, so before HIV was treatable, there was a very strong link with the two, and you had HIV dementia, which still can occur, but which is completely treatable and even reversible with antiretrovirals. So as long as people are identified as being HIV positive and are put on proper treatment, one can avoid the dementia that goes with that.
And in terms of looking out at some of the common warning signs, I mean, we're learning that with all the information, around 45% of cases of dementia are potentially preventable. What should one be looking for to, in fact, try and prevent it?
Okay, so it's not so much what the warning signs are, because I think you need to have begun a lot before that. People just need to be aware of brain health. What must you do to keep your brain healthy? So we've already spoken about diet and exercise, but there are many other things. For example, if a person has visual loss or hearing loss, that's a definite risk factor for dementia because you're not getting the input from the environment. So those are things people should look at. Smoking, which is on the rise again, especially in younger people, is also an important risk for many diseases, but also for the brain.
Yeah.
Social isolation, for example, especially during COVID and people were shut off, and especially older people, and that probably accelerated the problem. Alcohol is a big factor, alcohol by itself, but also because it leads to accidents and head trauma. Making sure you don't have undiagnosed medical problems like blood pressure, because you don't feel sick from blood pressure until it causes a heart attack or a stroke or something like that.
Yeah. Absolutely. Very well. Thank you so much for speaking to us this evening as, of course, we wrap that conversation with World Brain Day being observed. Dr. Stanley Wolberg of the Neurological Association of South Africa speaking about some of the prevention methods as we reflect on the bigger and long-term impact of brain damage.